Good evening, Doctor. Welcome to this show with Uncovering India. It's a privilege to and an honor to have you on our show. Our heartiest congratulations to you for being able to successfully deliver a baby of an COVID-19 mother who was also suffering from pneumonia. It must be some task that you went through. How does it feel? You feel satisfied, gratifying? What are the emotions going through your mind right now?
It definitely feels satisfying, but at the same time, it feels like there's still a long road ahead in terms of the load we are getting of COVID-19 at this current point. So I'm just happy to play a small part in the whole, whole effort.
So I believe this is first of its kind achievement in a small hospital private setup, that also a non-corporate setup. So it must be some challenging because small hospitals don't have the kind of wherewithal and the infrastructure and the support staff. So there must be mighty challenges that you must have gone through. So can you take us through the process, how the patient arrived, what was your assessment, how did you take the call, and what were the challenges that you faced?
Yes, absolutely. So this patient arrived to us on the 10th day. She came in a helpless situation. This patient was still spiking on the 10th day of her COVID symptoms. And that spiking meaning she was still having fever. The fever is not very good for the baby. And fever, especially after the 7th day of COVID infection, is extremely serious. So we decided in this week that the 8.5-month baby could be delivered. So we delivered this 8.5-month baby and aggressively started the patient on treatment. Patient had not responded to our treatment prior when we tried to control her fever. But after the delivery, she responded extremely well to our. I had backup of all my senior physicians, chest specialists, and the ICU and the intensivist ready while I was taking up this challenge. So it was really a team effort. It was an effort put in by the entire team of the hospital. At our hearts only lied, the concern for the mother and the baby. We wanted to do our best for the mother and the baby. Hence, we took this challenge up. We really did not think about anything else.
So what was going through your mind when the case came in, the decision had to be taken?
I really found a lot of senior of mine, who, when this case came to me, and right now the situation is such that the government system is getting overburdened. We do know that such cases are being taken up rampantly in the government system, but many a times, the patient wishes to, stay with a certain doctor. So I guess this patient wished to put her faith in me, and I really could not, let her go. So I wanted to see that this patient, she gets her baby, and they are both safe and healthy. So I really found a lot of support in a few in my senior gynacs. I did ask them for their opinion. My senior gynacs kind of guided me, supported me. I also a few government doctors and ask them about how they go about such deliveries, because this is very much taken, this is taken up a lot in the government sector, and they're quite used to these kind of deliveries. So I did take their advice on how to go about, and I think from both their help, from both their support, I only had to find the courage in my heart to do it. And when I looked at the mother's face and I knew that I had to give her the baby in her hand safe and healthy, I found that courage in my heart, and I think that is what made that little difference.
So what was going in your mind, and what were the technical difficulties that you had in your hand? I am told you have around 5 or 6 years of experience as a practicing gynecologist. So with that kind of experience, with such a critical case, you took that challenge. from your own self, how did that courage come in, and how did you? What was the reading of your situation?
Yes, so when this patient came to me and this situation was presented to me, I really did not think about, if I was worthy for it. I just thought that the situation has been presented to me. If this patient was my relative, somebody close to me, somebody of my family, I just rose up to the situation and thought what I would have done in this situation. So when the day I decided that I would take this situation, my husband definitely supported me. He made sure that logistically I could, my husband is Dr. Surlakar. He's a radiologist at Healthway Hospital. So he helped me plan it out. I had to start from assembling a team of doctors to make sure that we could take this to fruition. So when we made a decision, I remember this decision was made at 12 o'clock in the night when this patient's fever would not go down in spite of all our treatment. This was the 10th day of her COVID-19 pneumonia, and I knew that it was a kind of a red signal for us. Her fever would not go down in spite of all our efforts, and I knew that at this point, if we could not salvage the baby, then probably she would not be healthy enough that we can operate her. So we decided at that point that we will go in for the surgery. Her family definitely understood the severity of the moment when I explained to the family. So the family of the patient and the patient herself decided to put her faith in me, which was major. It only started from there. After that, I had to arrange right from the team of doctors. I asked for Dr. Neeraj to assist me. Dr. Neeraj Borkar, who's also a obstetrician and gynecologist in Margao. So I asked for Dr. Neeraj to assist me in the surgery. Dr. Kefas Kodros agreed to help me, to give anesthesia to the patient. But I had a tough time finding the NICU, that is neonatal care for the baby, because no neonatal care was ready to take a COVID-19 positive patient's baby. So finally, Classic Hospital, Dr. Suhail Nagarsekar from Classic Hospital stepped up, and he arranged the hospital, and he arranged an isolation for the baby wherein we could finally deliver this baby and safely ship the baby to a neonatal ICU setup. This baby was 8.5 months, so this baby required an ICU admission, and that is how I still remember. That is how we put everything into an effort. My senior mentor, also gynecologist, also helped me make the right decision, wherein this was a big step and I needed somebody to stand by me. So the senior doctor in Margao also helped me make up a decision and gave me clarity on my decision. So this definitely helped me make up my mind that I need to rise to the situation and simply not pass the buck to the government, setup.
So when the baby was finally delivered and it was in your hands and it was alive and kicking, what went through your mind? Did you have tears in your eyes, or you were like sighing you had a sigh of relief, or what are the emotions that you were going through? And you are a woman yourself, so that maternal feeling must have been also there in your heart.
Yes, but I did carry this baby, and I carried the baby. The mother has still not carried this baby, so I'm truly waiting for this baby to be reunited with the mother, and I think only then will I allow myself some happiness.
But then how it felt when you had the baby in your arms, going through such a tough ordeal and finally successfully delivering a healthy baby, and it was in your hands. So how did it feel?
It did feel it did feel gratifying, but at that point I thought that the baby's health and the mother's health needed to improve, and I wanted to give that much time for the mother and baby to improve before I made myself feel any good.
So what is the current situation now?
After I have discharged the mother.
So what is the situation now?
Discharged the mother. The mother
Okay.
is doing extremely well. Yes, the mother is doing well. She is discharged from my hospital as of Saturday, and she is, recovering very well. She's maintaining good oxygen saturations. The baby also is RT-PCR negative for COVID-19 pneumonia, for COVID-19, and baby is currently doing extremely well. So after the mother completes her quarantine, mother and baby are to be reunited.
So which means that even if the mother is COVID positive, so even if the mother is COVID positive, the baby will be can still be COVID negative. Not necessarily the baby would be infected.
Yes.
So does that
pass on via the placenta? So many a times when it is positive, the baby can be COVID negative. So very rarely will the baby acquire COVID infection via, delivery.
So in a way, the mothers to be who are pregnant and perhaps have contracted COVID-19 can still be confident enough and feel safe enough to deliver their baby.
Yes. See, COVID-19 is a very, very new virus. We really do not know much about it. We are discovering it as we go. So for this mother, this was the situation.
So, ma'am, every difficult situation teaches us some lessons, and this was a very unprecedented situation for you. So, what were the lessons you learned personally and professionally both?
So one thing I learned most is to have faith in my abilities and to have faith in the goodness, of the world. Basically, when I took this decision, I just wanted to, do something good for the patient, and it was a little free fall. But I'm glad that I was supported at the end of it. I'm glad the patient came out well.
What is the message that you would like to give to the community at large and the young medical doctors, gynecologists, whom they can emulate from you?
So community at large, I really would say stay safe. Let's support each other. Let's see each other to the to the other side of this. Let's help each other out as much as we can, and let's do our best to save as many people as we can. So this is I am just a very junior doctor here who wanted to try my best for my patient, and that's all I have done. I have done nothing big. I have just tried to help out one patient who was in need. So I just think I can help out more. I think I can do more for the community, and that is what I would like to. I would like to play my role in this war. That is.
And what would you like to tell to the young aspiring doctors who may come through such situations in their lives? What kind of mental pressure that they might go into? How can they handle such situations? What is your advice? What is your message for them?
All of us young doctors currently have stepped up our game and have been handling more than what we can handle. We are already out in the battlefield trying to fight this war against COVID, and we have been doing an excellent job at it. So I really don't have more to say. I just have appreciation for all the young doctors and everybody who is there fighting this war and not shying away from it. My resident doctors at my alma mater GMC who are fighting this war head on. They have been doing these surgeries since, I don't know, a year now. But I really thought that if I can put my little role here and, do my bit here, I would probably be able to take some load of the government system. So I'm just doing my duty, and I'm sure everybody is. So that is all that I'm doing.
Thank you, ma'am. Thank you for your valuable time with us, and we wish you all the very best for your future endeavors. And many congratulations once again to you and your team. And we hope that, and we are sure, not only hope, we are sure that with the frontline warriors, health warriors like you around, we don't have to worry about our fate. Thank you so much, ma'am, for connecting with us, and all the best to you.
Thank you, sir.